So now that we've talked about the anatomy and physiology of cruciate disease in dogs, let's talk about surgery and what we can do to try to help these patients stabilize the knee and slow down arthritis. Those are the two main goals with surgery. So let's draw a picture, and I'm not an artist, but I draw a nice stick figure. So here is our femur, and here is our tibia. And remember I talked about the meniscus as the pad, and then we have this ligament, the cranial cruciate ligament. And now remember the forces on the knee. When the dog takes a step down, the tibia wants to go forward and the femur wants to go back. And then this cruciate ligament, along with other structures, but the cruciate ligament is an important piece that keeps everything stable. So what we have found in a lot of dogs, the tibia actually has a bit of a slope on the back of it. And so your meniscus is here and your cruciate is here, okay? And if you think about the forces on that knee joint, our tibia still wants to go forward, but now our femur, it's almost like it's got a slope or a hill to go right off of. And it oftentimes goes this way. And it provides even more stress and strain on that cruciate ligament here, okay? And so knowing that many of these dogs have this conformation, the surgery that we recommend, that the surgeons that I work with do, is called the TPLO. And the TPLO stands for tibial, plateau, leveling, osteotomy. So tibial, this bone, plateau, the top of the tibia, leveling, we want to make this level. Osteotomy means bone cut. So just to kind of walk you through what the surgery entails. The surgeons will first go into the actual knee joint. They'll make an incision into the knee joint and they'll take a look at the cruciate ligament and the meniscus. If the meniscus is torn, which we know is an unfortunate complication secondary to this injury, if the meniscus is torn, they'll go in and they'll remove that piece of torn meniscus. We can't do meniscal implants in dogs. It's been tried. They don't tolerate it well. They reject that tissue. We don't want to leave that flap of meniscus in the joint because it's like a rock in your shoe and it's very uncomfortable. So they'll go in and they'll remove that piece of the meniscus. And they'll also, if the cruciate ligament is just completely inflamed and not adhered at all, they'll remove any remnants of the cruciate ligament. Then they close the knee joint up. And then the incision is actually made on the inside of the knee, so the medial aspect of the knee. They'll go in and there's some muscles that insert here. They'll just reflect those muscles back so that they're out of the way of the surgery. And then they take what's called a semicircular saw that they make an incision through the bone, okay? And now we have two pieces of bone. We've got the most proximal part and a distal part. The proximal piece, they actually rotate so that now it's more of a flat surface. And I know those, again, I'm not an artist. I know those pieces don't match, but I just want you to get the gist of what we're doing here. They rotate the top of the tibia to where now it's providing a very flat surface for the femur to sit upon so that we don't have all this abnormal motion. And then what they do is they place a bone plate that looks like this with 3 screws up top and 3 screws down the side to keep those two pieces of bone together and stable. So I want to show you, I have a picture. This is actually a planning page that my surgeon used for one of his patients. So the x-rays that we took, we sent to him, and he looked at the angle. So you can see, look how sloped the back of that tibia is. And the femur's kind of coming off the back. And inside you can see there's some inflammation, and that's just an angry knee. But he used this to figure out, okay, what's our slope now? What's our goal with our slope to get it more level? He also uses he's figuring out what size of screws to use. But then here's his finished product with the plate on the dog. And this is all computerized. They do this before they even come in the day of surgery, which is nice. Everything's already planned for your dog. And they place the plate and then they close up the incision. So after surgery, the pet is hospitalized overnight. They are on really nice pain control. We do epidurals before surgery. They get pain management before, during, and after surgery. Injectable pain management initially, and then we switch them to oral pain meds to go home. They have a bandage placed for a little while. They also have, we do immediate post-op rehabilitation, which includes some manual therapy, some ice and compression, some massage, things to help them feel better even before they're awake from anesthesia. We're working on them. And they stay overnight. We send the pet home the next day with a help 'em up harness, which a help 'em up harness is, I'm gonna show you a picture. This is what a help 'em up harness looks like. It is used to do exactly what it says it does. Helps them up, okay? So it's got a handle on the thorax and it's got a handle on the pelvis so that as your dog is trying to get up and move around, their front leg is going to be fine. But sometimes they're still a little weak on their surgical leg and they just need a little bit of confidence, and this helps provide some confidence for your pet. But we send this home. It comes in all sizes. We've put them on little dogs and cats. But this will really help for the first couple of weeks after surgery, and then post-op rehabilitation, we use those harnesses quite a bit. So the pet goes home with a help 'em up. They go home with an e-collar so that they can't lick or chew at their incision. That's kind of a big thing. We do not want them to lick at the incision. There's not a lot of skin between the outside and the plate. So if the pet is able to get at that incision and starts licking, we could potentially get infection down in and around the plate, and that would be a problem. We do send the pet home on antibiotics, which should help with that, but definitely don't want them able to get at their incision for at least the first 2 weeks. We always have the pet come back 2 weeks later and we remove the sutures and check the incision, and based on how they're doing at that point, we decide, do we go on with rehabilitation, or are you going to do a home care? And we just make that plan. At 8 weeks after surgery, we take an x-ray. And what we're doing at that point is we're looking, has those 2 pieces of bone healed? We're looking at this cut, right? We want to say, is the cut gone? Can we not even see it? And that's the goal, because we want those 2 pieces of bone to kind of interweave and be very strong and heal. We take the x-rays at 8 weeks because many dogs are healed by 8 weeks. Not all. Some dogs take 12 weeks to heal. And everybody hears 8 and they forget about the 12, but some dogs take 12 weeks to heal. So if at 8 weeks we take the x-rays and your dog is healed, awesome. We will give you instructions on how to return to activity. If at 8 weeks we take an x-ray and the dog is not 100% healed, then we're going to continue to do activity restriction and retake x-rays at 12 weeks, okay? So what is activity restriction? What can you do with your dog and not do with your dog during the post-op healing time? Basically, your dog needs to be under control at all times until 8 weeks, until we look at that x-ray. And under control means either in a crate or in a small recovery room. Like some people have an extra bedroom in their house and they can take out all the furniture and have the dog bed and food and water, and that's just where the dog stays. Not everybody has that as an option, so if you have a crate, that's great. If you can baby gate a bathroom or a laundry room or even a kitchen, that's fine. You want to make sure that the flooring though is not really slippery. If you can put down an old rug or yoga mats, that would be really helpful. And anytime they're not either in a crate or in a recovery space, they need to be on a leash. So let's say you're watching TV with your dog and it's 6 o'clock at night and the doorbell rings. your dog needs to be on a leash. Otherwise, the dog may jump up and run to the door. And that explosive type of activity is what we do not want. We don't want any running, no jumping, no roughhousing with other pets in the house. They can take walks, and we give you very specific guidelines on that, but everything always has to be under control. Ideally, if they don't have to do stairs, that's great. But if you live in a house that just has stairs, that's fine. You just need to use your Help 'em Up harness to give them a little bit of support to get them up and down the stairs. So that is the surgery in a nutshell. I know it's a lot of information, but the important part is our job is to keep your dog comfortable and control the pain and do anything that we can to slow down arthritis. Your job is after surgery to keep the pet calm and quiet and not allow them to overdo it, so that when we take the x-rays at 8 weeks, they're healed. We do also provide you with medication to help keep the dog calm. If you're wondering how you're going to keep your young, bounding, healthy dog calm for 8 weeks, we do have a medication that we can send home so that it helps them relax and take the edge off. But it's definitely a team effort. We're here to help you, but you've got to be on the team for the dog so that we get the best outcome possible.